Hey there, this is Dawn. Welcome back to the Life with Old Dogs podcast. Today I am here with Courtney White and I'm looking at my notes here because I'm always just stumbling over things, Oklahoma K9 PT. And I'm so happy to have you here today. Welcome. Welcome, Dr. White.
Thank you for having me. I'm excited to be here.
We're excited to have you. So now I was doing a little research about you, and I see that you are a certified canine myomanipulative functional therapist, certified canine rehabilitation therapist, a doctor of physical therapy, motivator, and leader. You've been a busy girl, haven't you?
Yes, I have.
Can you tell us a little bit more about yourself and your journey?
Yes, thank you. So I started out as a physical therapist doing home health care here in the Tulsa area, focusing on geriatrics and immediate post-op cases in the human population. And then as time went on, I was looking to help others, and I came across canine rehabilitation as a profession. And I realized, I love to help using my knowledge to help others get better. And I would love to do the same for dogs. And there really wasn't a huge market yet in our area for people doing this. And so I decided to go ahead and pursue the myomanipulative functional therapy, which is more of a massage certification, and then went on to go ahead and get the full rehabilitation certification as well that they provide.
Okay. So you started out with people first.
Yes, I actually am a human PT by trade, and I have been working with humans for about 10 years before I started working with canines.
Okay, so I just have to ask, um, how is it working with people and then dogs for the physical therapy? Obviously, one can bite when they're not happy about something. They can't tell you how they're feeling, and obviously the other can. So how do you deal with that?
It is very interesting. So I do find a lot of similarities between the two populations, but a lot of it is picking up on signs and looking at the body language, which we actually do a lot of as well in human therapy. So I was very primed to kind of be looking and watching for things that could be construed as pain or dysfunction, things like that. And so I use a lot of hands-on skills and just watching to be able to learn from the dog to tell me what to do. But yeah, the dogs can physically bite, but sometimes the humans can bite too.
Um, oh, I'm sure, especially, people are in pain. They're trying to get through the physical therapy. I've been in physical therapy myself for my back, and I have to say, sometimes it can be painful and it's not completely enjoyable. But I know, you know what? Once you finally do get through it and you stick with it, you really do feel better afterwards. There is quite a bit of benefit from it if you can stick with it. Um, can you tell us a little bit about the myo manipulative therapy? What exactly is that for people who don't know?
Yes. So myomanipulative therapy is a very like a massage therapy where we are manipulating the muscles and tissues, all of the tissues, not only muscle, but connective tissue, ligaments, and all of that. And we are using different techniques to help either relax the muscles, stretch the muscles, prime the nerves to work properly before we do the exercises. And then, of course, the traditional range of motion and stretching, all of the things that need to happen at each individual joint so that we can get proper function.
Okay. So that is prior to actual physical therapy.
I
Is that
typically
correct?
do that in the beginning of each session. So I like to start with the massage therapy portion, manipulative functional therapy in the beginning to prime everything to get ready to go. And then we move into more of the physical exercise portion.
How do how do most dogs respond to that, to the massage and being touched? How do they respond to that? I mean, I know everybody's different, but how do most respond?
It really depends on the dog and the age. So most of the dogs that I see are considered geriatric or seniors, and most of them really enjoy it and will actually settle down and almost fall asleep during the sessions. Some of the smaller dogs or maybe the younger dogs are a little bit trickier to kind of get to lay down actually, but so sometimes we will do it in standing, whatever they're most comfortable with, or I'll even sometimes switch it around and start with some of the exercises to get them a little bit worn out so they can be a little bit more relaxed for the massage portion.
Okay. Yeah. Who wouldn't love that, right? And I hear what you're saying with the seniors here. We have a therapist who comes to the sanctuary, and about 8 out of 10 of the residents here, it's just what you just said. They see her coming, they love her so much, they know they're getting a massage, they feel really good about it, and then she starts going into more therapy with them. That's a little bit more intense, but they just, I can tell they love it.
Yeah.
Um, okay. So when you get, you said, first of all, you said you get mostly seniors and geriatric dogs. So I'm assuming younger dogs you may be getting what, possibly due to an accident or a sprain or an injury, maybe from being too active or something along those lines. Older dogs, I would assume you're seeing them more for degenerative issues. Is that right?
Yes, typically, degenerative conditions like arthritis is the number one, of course. And then overall, just aging, where we're getting a little bit of that muscle atrophy or muscle loss as they just continue to get older. And then, of course, in German Shepherds, particularly things like degenerative myelopathy.
Okay. So yes, and can you tell us about this beautiful dog behind you, since you touched base on it, the DM, and I'm assuming that up there
Yeah.
had DM because of the wheelchair. Can you tell us a little bit about that?
Yes, in that picture there, that is Bailey. She was a rescue that I had from the Oklahoma German Shepherd Rescue. I originally took her in when I was first starting my rehab certification. They had originally thought that she had just had a stroke. And we did get her up and moving from that, but she never really got back to what I would consider, normal or adoptable at that point. She still had some difficulties. And then over time, we realized that it was actually degenerative myelopathy. Um, and she continued to progress with that. And we did get the wheelchair for her. And I did eventually actually add front wheels to that wheelchair as well, so that she could, live out the best she could to her final days. And she was actually a big inspiration for me to help write what I have that called the Senior Dog Workbook. And this stemmed from the fact that I knew that degenerative myelopathy was a condition that was not going to get better, but we were just going to be able to support her until the end. And it was going to be a difficult decision to determine, well, when is it going to be time to let her go? And so I started putting my PT hat on and looking at things that we do. In the PT world, we're always looking for objective measurements and things like that to help us really see what's happening and not just necessarily from the emotional side of things. And so I put together a workbook to help walk people through recognizing the early signs of aging all the way to making an end of life decision using different objective measurements that we have to look at their physical function, look at their quality of life, and take a look at these things as the dog continues to get older so that when we do get to that last stage, we can have something outside of ourselves to help us know that we are making the right decision.
That's perfect. It really is. And I know we were just chatting off camera about this, and you touched on the emotional aspect of this, which of course it is incredibly emotional, an emotional time for most people. And again, like I told you, it is the number one most asked question that I get running the sanctuary here is, how do you know when it's time? It's different for every dog, but to have something like that in writing as a reference, a point of reference that someone can refer to say, okay, well, back in March they were doing this. Now it has progressed to that because additionally, life happens. We all have so much on our plate, and sometimes we may forget how long, you know, the dog has been limping or hasn't been able to use its left leg. And it's really a good thing to have it written down, to have that point of reference to see the progression of the dog, because none of us want our dogs to suffer. I don't think any of us want our dogs to suffer. And it's a wonderful idea, a wonderful tool. And just so everyone knows, I am going to include the link to that manual for you to purchase. And I think every senior dog owner should have it, honestly. Um, so so how long how long was she showing signs of degenerative myelopathy until you finally said, we've done all we can and now it's time to say goodbye? How long did that go on for?
So it was an interesting case because, initially we did think that she just had something called a fibrocartilaginous embolism or a spinal stroke that was causing these symptoms. And initially that may have been the case. We're not really sure. So from the time that I actually took her in until the time that it was time for me to say goodbye was about 2 years during that time. So if we were to assume that it was that initially, then it was about 2 years. But I would definitely say for sure about 18 months because I did go ahead and have an MRI done and things like that to confirm that the diagnosis. And so during that time, it was a lot of support of just trying to keep her as active as possible because, as we know, there is no real cure for DM, but there's only a way to slow the progression of the disease process and support via compensation and compensatory things like the wheelchairs and things like that. So the newer research at the time was coming out showing that physical therapy or physical exercise in combination with laser therapy were the two things that could slow the progression of degenerative myelopathy. So those were some things that I focused on with her during that time. So I do believe that those were what were keeping her going, keeping her active and doing those things with her.
And I agree. I agree. We do the same thing here with the laser therapy. But how about hydrotherapy? How do you feel about that?
I think that it's very dog dependent, honestly. In our area, there's very minimal access to the water therapy. I think there's definitely a difference between, underwater treadmill versus swimming. I think they have two different outcomes. I think they can be very good if the dog likes water. And it also depends on the stage at which you're starting the process, particularly with these degenerative myelopathy dogs. In my dog's case there with Bailey, we did try some water therapy. However, by the time we got her in there, she was not really able to tolerate the force of the water as she was walking. Even though she was buoyant, she just was not able to overcome walking through the water. So I do think, it can be helpful for some, but at some stages we need to go ahead and go to the land-based therapy. And then my favorite thing about the land-based therapy is it can be completed at home with your dog every day versus, having to go into the appointments and things like that as far as the underwater or the swimming would be.
Sure. And I agree with that as well. And it's the same for us here. I think the closest one is maybe like an hour and 10 minutes away from us. I would love to eventually have one right here at the sanctuary and be able to utilize it for our residents and for folks nearby who may need it. But I have noticed the same thing with the hydrotherapy. The further along they get, they really just kind of want to stand there. They're not really or they just get panic stricken. And then there are those who absolutely love it. They think it's like a playtime,
Yeah.
and want to play. But it definitely is beneficial, no doubt. But living for us, living in a rural area, or for other folks living in an area that's not an option, or even if it is, to do the land-based therapy at home, like you're saying, I think would I think most people would be looking for that kind of service. So we've touched base on degenerative myelopathy and therapy for dogs with degenerative myelopathy, and I agree. It does extend their lives, their quality of lives, as opposed to just leading a sedentary lifestyle, not really getting them up, not really moving them around. Um, Now, what are some of the other ailments that you treat for older dogs? What other ailments would benefit from physical therapy?
Great question. I would say the most common condition that I see would be just generalized arthritis and what everybody kind of knows as back end weakness. That back end just starts to sink. People often start to notice those muscles are not looking as big as they used to, especially as compared to the front legs. And so, mainly those types of things. And then, of course, in particular, hip dysplasia is another extremely common condition that we use. And honestly, all of those things kind of boil down in a very similar bucket, if you will, where, we're looking at chicken before the egg, where did the arthritis happen and then the muscles got weak, or did the muscles get weak and then the arthritis got worse and caused more pain, more dysfunction, loss of mobility, things like that. And so our goal is always to address all of these things together and make sure that we are hitting all the aspects, not only the muscle portion of it, but making sure that we're taking care of the joints, whether that be with prescription medications from the veterinarian, nutraceuticals or herbals from the veterinarian to kind of help keep those joints nice and healthy as we are strengthening the muscles and all of that. I do think that there's definitely multi-factors that go into play when we're looking at, how to treat these older dogs' conditions.
Oh, again, agreed with you there. Boy, we are speaking the same language. Do you mind if I ask what do you have any preferences for supplements to use for keeping the joints conditioned?
I think, again, just very dependent, and you'll always want to check with the veterinarian before you're looking at it. But I think as far as arthritis is concerned, some of the newer research is showing things with green lipped mussel, hyaluronic acid, actually inside their omega 3s are some of the newer components that they're looking at. Also, some turmeric based supplements that are going to help address the inflammation. And these are, of course, in addition to the glucosamine and chondroitin that everyone is familiar with, even for us humans. But there is, some debate on that as well. So I think, getting with your veterinarian and determining which is best as far as, how far your dog's arthritis has been progressed, and where you need to start with that. And especially if it's a younger dog, it's sometimes working with them on starting them earlier on to help protect the cartilage longer life is good. But those are going to be a little bit different for some of the younger dogs versus the older dogs.
Okay. I've actually been hearing that now. Starting to give them these supplements younger in their younger years. And my ears perked up because I needed this, but I ended up with a German Shepherd puppy last November, and my husband and I decided to keep her. So it's been interesting. It's like having a toddler in a nursing home with her. But I do want to keep her as healthy as I can for as long as possible. So I am looking into this green-lipped mussel. We use that as well. Everything you just mentioned. Some of the folks that follow along with Woody's Place and the Life with Old Dogs have now started using green-lipped mussel themselves to try to keep their joints
Great.
as cushioned for as long as
Yeah.
possible. So the couple that I've mentioned it, I said, well, let me know how that goes because I would be interested too.
Yeah.
Okay, so arthritis, hip dysplasia, which of course is such a big one for German shepherds. Also elbow dysplasia. We get quite a bit of elbow dysplasia as well. Do you see that, or do you treat
Yes,
for
I
that?
do. I definitely see elbow dysplasia, and anytime I'm seeing front leg issues, I'm always checking the back end as well, just because dogs naturally bear 60% of the weight in the front and 40% in the back. So they're more prone to front end injuries. But sometimes those front end injuries tend to be related to the dog having something going on in the back end where they're having to put more weight up there. So I'm a little suspect always of the back end whenever we see those things in the front, but true elbow dysplasia is definitely something that can happen even, mild from a puppy on up, but just kind of rears its head as they get older and start to put more weight into those front legs.
Yeah, we've had it now twice here, and I will say I noticed actually right away that even their elbow placement just didn't look right when they were standing. Like it kind of went out, and now I know what it is. But when I first saw it, I thought, "What is wrong with that dog's leg?" And
Mhm.
it was elbow dysplasia. So, and I don't know if this is true, and maybe you can confirm this, but we were always told to keep the dogs on the lighter end, keep excess weight off of them because it's better for their joints and even extending their life. Is that? Do you feel that's accurate?
Yes, that is actually my number one point, actually, with my owners. And I do discuss weight management with every single client, whether they are considered overweight or not, because keeping their dogs trim is actually the number one thing you can do to help the progression, slow the progression of arthritis. You're not necessarily going to prevent, but definitely slow the progression of arthritis. As well as preventing other major injuries like CCL injuries or ligament tears in the knees, things like that. There has definitely been some research, and this is in the Senior Dog Workbook, about how keeping your dog at an appropriate weight can actually extend their life up to 2 years if
Oh,
they are not
okay.
overweight during the course of the life. That was a very interesting study that they did with golden retrievers. And then I also have found that even with the CCL injuries, and this is definitely true for humans as well, we know that for every pound that you're overweight, it adds additional pressure to each one of those ligaments. And so it just puts you at risk for tear. So even if you're just decreasing your dog's weight by 1 to 2 pounds, it's going to take a lot of pressure off of those ligaments and hopefully help prevent a tear.
Hmm. So there you go, people. You heard it yourself. No, that and it makes perfect sense. It really does. Um, but I've heard that, really, I'm in my 50s, and I've heard that since I was a kid from people in my family who were farmers and whatnot. Oh, let the dog run, keep them light. And I guess they knew back then. That's
Yes.
so. So the physical therapy, um, keeping your dog moving. And again, we inco- what we try to do here at the sanctuary is we do short, frequent walks throughout the day for our residents. Um, if if some of them don't want to, I leave the door open. They can come if they want to. The whole thing is fenced in here. All of our acres are fenced. They could come and join us if they want to. If they don't want to and they just want to go lay out in the sun, they can go do that. So they do what they feel like they can do, what they're comfortable doing, but we still do short, frequent walks throughout the day. And it could be like 20 minutes a pop, 15, 20 minutes a pop, but I get them up, I get them moving, maybe toss them a few balls, few frisbees or whatever. And we're probably out about 7 or 8 times a day doing that. So I feel like they're getting a lot of exercise, a lot of activity, just not in one big chunk, like maybe a younger dog can do. How do you feel about that? The short, frequent walks.
I think that's great. Because as you mentioned, since they are mostly older, they're not going to be able to tolerate those longer bouts of exercise and things like that. And I'm glad that you brought that up because, since you are going outside multiple times a day, maybe one time the dog wants to go out and walk around, and then the next time they want to go lay in the sun, and then the next time they just want to go out and sniff. And sniffing is actually just as effective as in burning calories as walking is. So they have done some research on that and found that foraging or sniffing like in a snuffle mat or out in the yard for 15 minutes of solid sniffing can be the equivalent of walking the dog for 1 hour as far as calorie burn. And so that's why, letting them just even walks where they're just sniffing, even though if you cover one block, but you have let them sniff for 15 minutes, that's just as important as allowing them to actually do the physical exercise. And of course, we need a balance between the two, but getting all of it in is also really important, and keeping that mental stimulation as well.
Yes, we call them sniffaries.
Yes,
Yeah,
exactly.
that's what we do, and it's so funny because when I do take them off the sanctuary grounds, one or two at a time, and we go walk at a local park or on a hiking trail. To them, it must be like reading the Sunday paper to us. I mean, their noses are just glued to everything.
Yes.
And I agree about the mental stimulation as well, and the balance. Even car rides, even like a 10-minute car ride can be so beneficial for their mental stimulation. To me, it is about overall health and balance, just like you're saying. So, and incorporated in that for us, we do a lot of home cooked food here. So I am certified in canine nutrition, and I'm really kind of fanatical about it, and making sure that they're getting their balanced meals, even if it's a meal topper. If I don't have time to do like even 20% of real food on top of their kibble is so beneficial to them. So, do you are you familiar with anything about that? Like, I'm sure you are with diet and whatnot. Can you talk a little bit about that and how it helps with therapy for the dogs?
Yes, I do, not only in weight control, but also the quality of the ingredients going in as well. I do find that, the fresher we are able to feed, whether it be a home cooked meal or even raw feeding up to that, I do find the dogs tend to be able to perform better. So not only because we are losing weight, but we're losing a lot of that systemic inflammation that's just kind of floating around and keeping everything inflamed. And as they come off of, maybe like a more highly processed diet, it can help diminish some of these symptoms that we're seeing with the arthritis and things like that. And so, really striving to try to, like you said, even if it is just 20% of the bowl being a little bit fresher, there's definitely things that we can put in there to help kickstart, you know, um, natural anti-inflammatories to help combat some of that as well, in addition to any of the medications and nutraceuticals that you may be doing as well. So I do always talk about that, and trying to at least look at bare minimum the number of calories people are feeding and making suggestions for fresh toppers. And then also just talking people through potentially, doing a home cook or like a commercial raw or something like that.
Hmm. Yes. Again, 100% agree. And the processed food, and I'm not food shaming anyone, but I always try to educate about that, that not only is it just loaded with ingredients that aren't good for our dogs overall, it's actually contributing to inflammation in the body that is contributing to these degenerative um, illnesses and diseases as they age. So yeah, 100% agree with you. And I mean for us too, for even humans as well. Yeah, if you can incorporate real whole cooked food, it goes a long way.
Yes, exactly.
Um and you have a blog as well. I was on your website and you have a blog, and I was so happy to see that. And it's current as well. And you have a really great article on there. The number one reason why dogs slow down as they age. I definitely want to steer our listeners to your blog as well, because it's loaded with valuable information.
Yes, thank
Because
you. Yeah, we try to touch on a little bit of everything. It's a lot of tips that I give to my own clients. Definitely have some on there about some superfoods and things like that that we were just touching on, that we like to give out, so that people can know that they can add in a little bit of these fresh items for their dogs and kind of know why they're putting them on there, and what kind of benefits they could potentially see from adding these foods. In addition to like all the other, there's a wealth of knowledge in there.
really is. There really is. It truly is a therapy and wellness center that you have there. Um, I wanted to ask you something about the actual physical therapy itself. So, if you, I guess when they're younger, if it's an injury, they're coming in. Maybe they're coming in for a certain therapy and for a period of time, and then they move on. But with older dogs, it is really a maintenance thing, isn't it? Where they continue to come and see you. Is that
Yes,
correct?
exactly. Of course, it is an ongoing thing. And that's why I always position during my initial evaluation, my goal is to educate the pet parent. And we actually become a team to try to help this dog as long as possible. So even if people just come to see me for the initial evaluation, we assess the dog and we discuss, where their current condition is and what their goals are for their dog, what kind of things they want to be able to do. And then we'll say how often they need to be doing this. And of course, my number one goal is to always give them an exercise program that they're going to be able to use at home to help their dog stay active and strong as they continue to get older. And depending on, if they're coming to me, like you said, if they are earlier on in the process where they're not necessarily injured, we can set them up on this program and then they can carry out this program, sometimes even for 3 to 6 months on their own before they need a tune up or anything like that. And I've even had people tell me that the dog was doing well and then they would get injured, but then they knew what to do because they had already come to see me. They knew to let the dog rest. They knew to put the ice on the dog. They knew to resume the exercises as the dog was able to tolerate it. And sometimes, whether that's good or not, they didn't have to come back to see me. But that's what I want to do is empower all of the pet parents to be able to help their dogs at home, just in case they don't have access to anyone or can't get in to see anybody and get help for their dog. Because I believe everyone can help their dog at home with some of these massage techniques, exercise, and all of that.
Or uh, so long as they're doing it correctly. I think that's
Yes.
the key thing. Yes, people definitely want to do this. Yes, not everyone has the time or the access to actually go to a brick and mortar location. So
Mhm.
to learn how to do it at home correctly is key, because I think that's another thing. I think a lot of people, they want what's best. They don't want to hurt their dog, and somebody
Yes.
might get in there and start manipulating, and the dog yipes, and then all of a sudden they're like, oh no, I hurt the dog. So
Yes, I will typically see the dogs for anywhere from 1 to 3 months before I feel like the dog knows the exercises well enough for me to kind of turn them loose with the pet parent completely and all of that. So it's definitely a learning process, and we need that initial time period for them to go and almost do like homework, if you will, and come back and say, oh well, we tried these exercises and this one worked, this one didn't work, and then we brainstorm together how we can either do the exercise differently or maybe just decide the dog wasn't ready for that exercise. So absolutely, you're 100% correct. And it does need to be done correctly. And so I do kind of keep up with them and monitor to make sure that we aren't causing any further issues, because that definitely can happen as well.
sure. Sure. Okay. Well, I think we're coming up to our time here. This has been wonderful. This has been fantastic. Um, can you tell our listeners how they can find out more about you and your services? Where can they find you on, if you have a brick and mortar store or your website, social media, where can they find you?
Yes, so the best place to find us would be on Facebook or Instagram at Oklahoma K9 PT. You can also find us at our website, which is where you'll be able to find the senior dog workbook and the workshop if you wish to look into that a little bit further at oklahomak9pt.com.
Right. Wonderful. Well, thank you so much for your time and all of your information. I just know this is really going to resonate with a lot of our listeners.
Great. Thank you for having me.
Thank you.